Good afternoon, everyone. We are doing a special with Dr. Kendra of New Orleans, Louisiana, and we are also doing Ayotunde out of Edmondton, Alberta, Canada, who the special discussion is around the COVID. And welcome, ladies. Thank you very much for joining. And let's just get rocking. Cabo, Tundeo.
Thank you.
So the reason we're doing this is because Tunde, I think I shared with you, Dr. Kendra, that Tunde was talking about, you know, what was happening there in Canada.
Okay.
And you and I were talking. So today's Area Magazine with Black Pearl Market is a special emphasis to just kind of talk about this COVID experience from two different perspectives. So Tunde, would you share with what we were talking about the other night in regards to what's happening in Canada? I mean, one of the things I just saw that kind of made me go, whoa, they just said that they were allowing travel to happen. The US is lifting our travel restrictions for November the 8th. What's the status of Canada's travel restriction? Is it lifted now?
You can come into Canada. The protocols to observe, like you have to be double vaccinated. You have to show.
Oh, wow.
Did you say double vaccinated? That part I didn't hear. You have
Yes,
to
you
get
did.
double.
You have to get both vaccines, both vaccinations, and you have to show proof of it.
What?
At the airport. Yeah.
Oh, my Lord.
Double vaccination?
Yeah. Well, that's the normal dose. Everybody gets double vaccinated.
So she's speaking of 2 shots.
She's talking 2 shots, not from 2 different
that's right.
companies, not from 2 brands, but 2 shots. Booster shot.
Yeah.
Okay.
2 shots. You have to have both vaccinations from whichever company that you're using.
Okay,
right?
now what's happening in the classroom?
Johnson & Johnson is 3. Pardon me?
Say that again?
Oh, if you're using Johnson & Johnson, it's 2 as well.
Okay, so here's my question. What is happening in the classroom for you as a teacher there in Canada? Paint that picture, and then I'm going to have Dr. Kendra come in and give her perspective too, because we're talking, Dr. Kendra, if I haven't set it up, she is she's licensed, certified. She's a naturopath. She's an MD, but she is really clearly a proponent of not vaccinating. And you are having to be forced in Canada, especially in your job, to be vaccinated. And so what I want
we're not forced.
Say that again.
Yeah, no, we're not forced. Nobody's forcing anybody.
Okay.
You have to be double vaccinated, or you take the test every day before you come in to show that you are not infected.
Oh, wow.
Everybody's safe.
Every day is what they're saying.
Well, yeah.
Okay.
You have to show that you're safe. So there are rapid tests to be taken that you can have your kit at home and take your test. And as far as the classroom is concerned, there is no specific well, which way should I put it? Nobody is forcing the children to take vaccinations, but they have to be COVID-free. And if you're sick, we're going on the trust system. If you are sick, keep your child at home. We have had cases of COVID in the classroom, and we have like a ceiling. If there are more than 4 cases in one classroom, the classroom goes blind. If there are more than 10 cases in the
Say that again about your mom.
Say that again?
Say the last part. I thought you said about your mom. Is that what I heard?
No, I said if there are more cases than 4 in a classroom, the classroom is shut down and they all go online.
Oh,
Oh,
wow.
Yeah,
all right. So if there's 4 cases in a classroom that's shut down, you go online.
yeah. If there's more cases than 10 in a school, the school is shut down and everybody goes online.
Okay.
Yeah.
Dr.
So
Green, go
we're
ahead.
going on the trust system, right?
Right.
So they're not making the kids take any vaccine at this point. But if you're sick in any way, coughing, diarrhea, swollen eyes, red eye, all the symptoms, it's all listed and everybody, takes, it's on school zone so they can kind of do a checklist for themselves. And we're going on that trust system.
Hmm.
Yeah, for the kids. But everybody needs to be masked. During school time, the kids are masked in the common areas, the hallways and everything. When they get to their desk, they can take their masks off and put it on their desk. But as soon as they get off and they have to move around, they need to mask up. When they're outside during recess, they don't need to have their masks on. But coming back into the school through the doors, to walk through the halls, they have to be masked.
Wow. Dr. Kinder, what's your thought on all that?
It's a lot of work. And that's interesting where the rules and the mandates differ from state to state or,
Country to country.
geographical area and country to country, because we own a preschool and I'm actually there physically at the preschool pretty much every day with dropping Kendra off and sort of overseeing the managerial aspects of it from day to day.
Mhm.
And as of now, we do not have the children wearing masks at all. And we care for children ages 6 weeks to 12 years old. The staff, according to the Office of Public Health, are mandated to wear the mask. And that's the gist of where we are right here in New Orleans. And
Mhm.
it's interesting to see the different rules and regulations from country and areas. That is a lot, and it's almost like the teacher is also wearing other hats like the
Yes.
social worker, the security guard,
Yeah.
because you have to ensure that those children, and these are children, not adults, that are wearing their mask, and you're responsible for that. So it's added responsibility. So I guess my next question is, with the added responsibility, does added pay come with that as well? Or you just kind of do it because, this is what you're being asked to do? Because that's a lot to put on a teacher.
What do you say, Tunde? You got a pay increase? Say that again. Did you get a pay increase with this new job position?
An increase. No, everything is done.
I mean, my hat
muted.
goes off to her.
You're muted. There you are.
Everything is done at a human level, and only.
It's muting again. It's doing it. It's playing with us again. That darn thing.
Yeah. Guess what? It's Eugene trying to get me, and I'm declining the call for now. So yeah, everything is done. With gentle reminders when they come out of their desk, and oh no, you need to put your mask on, or when they're coming in from recess, where's your mask? And if they don't have a mask, we have masks. We have disposable masks that we hand to them, to coming through the doors. Yeah, and then they have to sanitize their hands as they come into the classroom. Yeah, we just do it as we've always. My school board has maintained this since last year, so we never dropped the mandate when we went back into school this year.
Mm-hmm.
Right, and we noticed that school board, the county over, they went back without the mask mandate,
Uh-huh.
and they had to shut down because, because of COVID, the kids were bringing COVID in, and now that they are back, they have to wear a mask.
So how is the statistics right now in regards to Canada? I haven't been privy to the statistics. Do you have an update on what, has it gone up in numbers or is it kind of leveling down?
Well, this province that I'm in, Alberta, has gone up. So we're actually in a state of emergency.
Okay.
So
Oh boy.
we're asking, first of all, we've asked the military to come and help us in the hospitals, and other nurses agreeing to come and help out in Alberta.
And
So,
didn't
yeah,
you also say, Tunde, not only are other nurses, but you're getting you're getting patients from other provinces coming to Edmonton to be in the hospital too. So there's an additional strain, right?
Yeah, there is a strain on the health system right now in Alberta. So nurses from other provinces are coming in to help us.
Mm-hmm.
Wow.
Yeah.
So, all right, doctor, what's your thoughts?
I'm listening to her. A while back, I created this animated real life character called Super Teacher, and actually, I'm the character, and it depicts a teacher being super with superpowers, and my hat goes off to this lady here because I think she's a super teacher.
Yeah.
For what she's doing and what she's being asked to do and what she's enforcing in her classroom. Not only that the classroom is a learning ground, but it also has become a mini laboratory.
Yeah.
And she's wearing all these hats. So I want to say thank you for what you're doing for our children. What's interesting is that when we were on the rise of COVID in the beginning, our preschool remained open the whole entire time. When everybody else was shutting down and closing their doors, we stayed firm and we stood there. So we were also super teachers or super administrators or super principals, super caregivers, and with that being said, I guess I'm wondering if the longer we deal with this thing, with this pandemic, with this virus, and it's mutating in another strand and another strand and another strand, I think as long as we do some basic things in terms of washing our hands, keeping our immune system healthy, and really socializing with the same group pretty much every day, 7 days a week. And I think that's how we kind of sidestep anybody becoming ill or having to be sent home, because it was the same group of children, the same caregivers, and we were doing those safe practices that were implemented with the Department of Health and hospitals and things like that. So this is something, and I don't think it's going away anytime soon.
Oh,
and
no.
like our friend said on the phone, they're in a state of emergency. So we're going to see more hospitals being built, insurance rates going up. It's just really, it's something to think about.
Now, one of the things I had asked Tunde is what was the rates or versus vaccinated versus unvaccinated. And one of the things, and clarify if I'm wrong, Tunde, it was like you had mentioned, it was like 70% of folks in the hospital are part of that unvaccinated audience. It's the same numbers they're using in the US, that 90%, which I shared with Tunde, is I think that they're skewed because it's the same 90%. They're using that same number consistently, which says to me something doesn't sound right, because you can't have the same numbers globally. You just can't, because we have different things happening. For example, Africa just now got its first order of, and not all of Africa is getting the vaccine. It's certain parts, right? Then Haiti is just now got its first batch after the assassination of the president, and then the hurricane. And we talked about this briefly in our last Zoom last Wednesday, Dr. Kendra, is they haven't even had a chance to react to having it because they have a natural disaster. So the COVID aspect is probably out of the water because they're trying to survive. The point I'm making is one of the discussions we're going to have in the magazine is the vaccinated. There's 3 conversations: vaccinated, unvaccinated, and we call it the natural measures that Dr. Kendra is kind of looking at. Now, I'm not supporting it, I'm not against it, but I definitely live it. So me as a professional human being, I live that. But me as a professional writer and someone who's looking at this from several perspectives, I want to make sure that we have an equal conversation on what's available. So let me ask you this, Tunde. In your family, do you mind sharing? Have you been vaccinated and unvaccinated? And where are you with your thoughts on this in regards to you and your family?
Okay, with regards to my family, there are different aspects that we have to consider, that we've had to consider. So first of all, I'm double vaccinated because I'm in the school system and I really don't have any time to be testing myself every morning. There's too much anxiety in that. My husband has underlying conditions, so he is double vaccinated. So my daughter that works in the entertainment industry needs to be COVID-free, so she's double vaccinated. Otherwise, she'd have to be testing herself every time she goes on stage or goes into the theater. Yeah, so we have taken the vaccine. There's a lot of anxiety around the world, to tell you the truth.
Yes,
right?
there is.
So, and there's, because of the anxiety, it affects your daily living, right? So you have to think about how you are going to make time to take your test, wait for the results before you set out in the morning, and then you have to show them that you get administration. On an administrative level in the school system, we maintain the same protocol that we've maintained. You can't come into the school unless you're invited. As a parent, right? You can't walk into the school. There are measures that you have to scan a QR code to say you're coming in, and then you have to sanitize when you come, and then you have to just wait in the hall for your child or whatever. Otherwise, all the kids are picked up outside. So at the admin side of it, also there's a lot of work and a lot of anxiety there too, to make sure that everybody is safe, right? Yeah. So on a family level, because of the work that we do, my husband has underlying conditions, so we are all vaccinated. And also, I come from a medical background. Both my parents were in the health system, where we took all the vaccines when we were growing up in Africa. We took all the vaccines and we didn't question it. My dad, encouraged that everybody should be vaccinated. Nobody wants to catch polio and rubella and this, that, and the other.
So right. you weren't, we've talked about this before, but you really saw the advantage of being vaccinated for you and your family more.
Absolutely. I saw the advantage of being vaccinated. And I also was very excited that in the United States, the girl that,
the doctor, yeah.
Yeah, the doctor, and she's been working on this RNA for a long time. So it was as if, oh my goodness, we have the base. All we have to do now is make sure that the vaccine comes out in a safe way. So that was pretty exciting for me.
Okay. Dr. Kendra.
Yes.
This is your chance. You are of the mindset that's a little different from this. Would you share?
That's not to say, sorry to interrupt you, that's not to say that I don't appreciate any other kind of remedy. We believe in a lot of herbal remedies in Africa as well, so all that is there. But
Okay.
like everybody, according to the way their life is at this time.
Okay. Dr. Kendra.
I think she's absolutely correct. You do what works for you and for your family. As far as the statistics, I think you were speaking about the statistics and the data. We can make statistics and data say whatever it is we want them to say.
Mm-hmm.
So for you to feel like, yeah, we can't have the same statistics here as we have in Canada, it can't be, and I believe that you're correct. So we can make data say whatever it is that we want it to say.
The doctor's name was Dr. Kizmika Corbin.
Yes, correct.
That was the doctor who was behind the key factor, the 34-year-old doctor who was part of this vaccination developing.
Yeah,
that's her name.
And
Please continue, Dr. Kendra.
Well, I was going to say there is no way that the statistics could be the same because you're talking about two diametrically different countries,
Exactly.
geographical areas, certain external factors present in one, absent in the other, different numbers and population. There's no way the numbers can be the same.
Exactly. That's the only thing I keep kind of going, you can't have the same 90% because that 90% is being used. If you listen to the sound bites, Canada, Germany, they're using this 90% as their gauge. And I'm going, something isn't right here. It can't be the same number. Now, I can say that I don't know what I'm talking about because I'm not my mom and dad, which were also in the medical profession. I cannot say that I have the same knowledge as you, Dr. Kendra, but I am saying that there appears to be something's not totally being shared. And it may just be the realistic value of saying, 90% of the patients we saw are are unvaccinated, and the 10% are vaccinated who are catching this. Okay, I understand that, but it can't be the same consistent numbers. It just doesn't add up. But I can say that with this discussion, I want to thank Tunde for her time. Do you want to stay on with us, Tunde? And
well, I'd just like to say that to get what is happening in Alberta into perspective is that when we had that discussion, right, I was telling you that 70% of the people that are in hospital, I said, because we go with how many sick people there are, right? So all surgeries have been canceled. We're only dealing with COVID in the hospital.
Wow.
The admission, right? That's what we're doing, and that's what we go by. How many beds we have available? That helps us open up or tighten up, right? So we're in a state of emergency. 70% of the people that are dying are unvaccinated. That's what they're saying. Okay. So the hospital is focusing on COVID treatment right now. Okay. So if you're sick or whatever, they try and keep you out of hospital because there are no beds. Yeah, because there are no beds.
Okay,
So they try and make sure, but there are no surgeries, no whatever.
nothing. Because you're,
So, yeah,
and thank you for getting me that adjusted percentage, because now that makes me
Yeah.
kind of go, okay, because 70% is completely different than 90%.
Right.
But that 90% in the conversations I'm having with other folks, that 90% is a soundbite. Whether we're doing it intentionally or unintentionally, it's coming up in our conversation, just you and I just talking, and then we talk to someone else in Nigeria or talk to somebody else who says, and it's the same numbers. That's startling. But I'm glad that you gave me the updated numbers, which is 70%, because now I can kind of go, okay, I can see there is a big difference from 90 to 70. It's not.
But that is in Alberta. That is
Yes,
in my province.
I got you.
I don't know what's going on in all the other.
No, and I don't want you to know that. Just what's happening in Alberta, because Alberta is clearly different than any place other than Quebec or Toronto or Halifax. They're all completely different.
Exactly. Or any of the provinces that the nurses are coming from. Obviously, then they're not too busy over there, and they can find time to come and help us out here.
Yeah, because they don't have the same urgency.
They
Right?
don't have the same stress. Exactly.
You don't have the same urgency. So, but thank you, Tunde.
In fact, other provinces are telling Albertans not to come to their provinces, to come into their province. Yeah, because we're so sick.
Wow. Dr. Kim, you have anything you want to add to her last final appearance with us? Anything else you can think
I just want to commend her again on a job that she's doing, that's doing a phenomenal job with the children. And I guess I would leave you with, do what works for you. Now, when we were working through when the height of the pandemic first happened, it was 5 teachers on staff. Only 1 was vaccinated. And everyone stayed well. So
this is truly this COVID thing. We have clearly not gotten all the numbers, all the detail, all the data, because there's so many different experiences happening for people. In your school, you're having people not getting sick, as far as what you know. As of right now, you are a true case study, because you have a facility with X amount of children, the same staff, same parents dealing, and no one has gotten sick from your awareness from the beginning of this COVID to now.
right.
We have is Tunde is there in Edmonton, where she is in a school system that she is seeing children where there is clearly a difference. They are not in the same zone as you. They don't see the same people in their lives. It's a much bigger audience. It's in Europe. It's in Canada. There's a completely different diametric, or should I say, a demographic than what we're experiencing in New Orleans. I mean, we can go in another family and they are 5 or 10 people, but 2 of those people are going out every weekend to party and they're bringing back whatever. So, it's really an interesting study. I want to kind of just continue to have discussions, because having a teacher, we know that teachers are feeling it on the front lines. I mean, they're not on the front lines, they are the lines. Let's be clear about that. We know that teachers are experiencing. Not only are you dealing with emotional stress, you're doing spiritual stress, you're dealing with your family. You got to go home. If you're infected, you got to take that home. There is a lot of different aspects that we're experiencing. I experience in my world of being really simple and safe in my little world. So, but thank you, Tunde, and tell your husband thank you too. And we will. All right. Thank you both. And we'll talk to you, Tunde.
All right.
Bye-bye.
Take care. Let's talk
You
later.
too. And I'll be back in touch in the next day or so. All right.
A nice meeting, Dr.
Kendra.
Dr. Kendra, thank you so much for all the work that you're doing also. And
Thank you.
they're taking measures. Obviously, you're taking measures too, because everybody is in a pod, and the pod maintains the same contact and everything, and that's what's keeping you safe. So we really want to thank you. I really want to thank you for all the work that you're doing.
Thank you, beautiful Tunde.
Right, yeah.
Bye-bye. Ala Farafuni.
Alafia point. Bye.
Bye. Okay, so that's interesting. This is very interesting. I'm telling you, there is something going on. I can't for the life of me tell you that we know that everyone is using this 90%.
Yeah.
Not only here, she changed the numbers because she probably did some research and said, oh, this isn't 90, but it's 70. That's still a big difference than 90.
Yeah.
You know what I'm saying? I think that statistic is maybe 40 to 55% that are vaccinated and another percent that are unvaccinated. I'm just saying, I don't know that. I have no stats. I don't have proof, but I can tell you the one thing is the numbers are not adding up.
They're not.
There are far too many people who still are unvaccinated in the US. I'll only talk US.
That's why they're making such a big deal out of it, threatening people to get it, or the ultimatum is you lose your job, or fining you if your spouse is not vaccinated.
Oh, yeah, you were saying that.
If there were as many people vaccinated as they're saying are vaccinated, then all of those mandates wouldn't, those threatening measures wouldn't be in place.
Now, here's an interesting thing. Out of all of this, with the COVID, they're like in Chicago, the police union's president said he can't tell its members to disobey a city vaccine policy. But we know in New Orleans, I read another article just like this was Friday, and it had the Mayor Cantrell talking about her deciding if we're going to have Mardi Gras Carnival. Now I know October 23rd, there is the first carnival we're having here in New Orleans, the Boo Parade, right? During Halloween. That's going to be the test. But the reality is, whether we admit it or not, Mardi Gras is not going to look the same moving forward.
No, it's not.
And it's not going to look the same between now and the next 3 to 5 years, because we are still, this variant, did you know there was over 5 different variants that we have had?
It appears that one is happening every month almost.
I mean, I knew that there were a lot, but one was called, the Alpha, the Beta, the Gamma, the Epsilon, the Eta,
Delta,
the Iota, the Mu, the Zeta, and the Delta. Now, that is in a year and 8 months. That's like 1, 2, 3, 4, 5, 6, 7. That's like 10 variants. We haven't even made it to 2 years yet. We haven't even made it to 2 years yet. So my thought is this. You've said it, and let's talk it again. How can people stay centered and healthy if they are not doing the vaccine? What is it that they need to do? Would you give us
the first thing is finding a balance between mind, body, and spirit. Finding a balance, spending time meditating, spending time, if that's your thing, you do, reading your Bible, reading motivational pieces, just freeing your mind and staying focused, and then taking care of your body, getting some exercise, walking a little bit, keeping your body in motion. The bodies have to stay in motion. And then, which is the last thing, but not the least thing, eating right and eating healthy, changing our habits. Today I visited and I brought some more supplements and natural remedies to another person with cancer. Something is wrong with that, and just like pharmaceutical drugs, plant-based medicine, neither of them are going to work if you don't put in the work yourself, which is changing some things in your diet. Or changing some things in your food regimen. And if you can be healthy in terms of your food regimen and eating healthy, um, eating healthy and exercising and staying focused spiritually, then you can stay healthy and keeping your stress level down, which is very hard to do right now.
Mhm.
Keeping your stress level down, because when you're stressed out, then that will cause your immune system to go out of whack, and then that's when diseases can step in and you become sick when you're stressed out.
Mhm.
And then starting a very simple regimen, supplement regimen, revving up on your vitamin C, your zinc, your selenium, moringa.
You're on mute and you went, there
Oh,
you are.
you there?
There you
Yeah.
are.
So that's what I would tell them to do. We're getting more calls and more calls every day, and it's we're getting so many calls until we can't keep up.
Yeah, so this is not going away.
No, it's not. No, and like we said on the call before, last Wednesday previously, before it gets better, it's going to get worse.
And there's really and
Because of what I know, that my family and I have remained healthy throughout the whole duration of this thing.
well, I'll tell you, my husband and I and my mother-in-law, those are 3 different camps. Those 3 different camps are that someone calling. Those 3 different camps is mother-in-law over 80 is vaccinated and we are not.
Oh yeah.
We are really making sure that we keep our health. I mean, what my favorite thing to do is to eat. I make faithfully, you're gonna laugh, I take my vitamin 12, but today I had a cabbage, a sauerkraut sandwich. Now everybody was like, sauerkraut, oh man, I put an avocado and tomato, my sauerkraut, which I do from home. I just slice my cabbage, put it on bread. I eat it, of course, with Ezekiel bread, and I'm good to go. That's my meal. Now,
Yeah.
why I eat that way is because I'm really busy. And so I'd like to sit and have like quinoa and greens, but my schedule lately is just that if I need something quick, I just put something in my mouth. I know that's healthy. And so it's like,
Yeah.
oh, you eat, I'm like, man, you just don't know what you're missing. That stuff is good for your guts. That's the probiotics that you need for either kimchi or sauerkraut that messes with the bacteria. I already know, but you know what? It's not enough. I mean, we far need to be doing more. But I'm so glad that we have you to have these discussions, because it really just shows this thing. We have to have these discussions. Schools are doing something not right. I don't know what it's not the same people in their lives. These children have different people coming in their lives, which change the dynamics. That's what's happening. And so you can only look at the thread, because if that family is a stable family, it's the same people in their lives, they can take them to school. So the variant is that you have a variable that's coming into a situation. That's what's happening. Someone who's not the core, someone who comes in is exposes. So I think that, I'm so excited when this article that I'm hoping just touches on it. But what I'm hoping to do with our online magazine, because we'll have an online version and a print version. All of these videos will be next to the printed version where people can just click on and get this little additional information and go, whoa, this is not what I expected. And that's because we're trying to make sure that we find ways to show that we care. We care about where people are. So do you have any last final words before I say thank you for your time?
Don't take this lightly, and wash your hands.
Oh,
wash your hands, drink your water, eat healthy, and stay safe.
That sounds like a good remedy for success. Hold on, I'm going to turn on our music and let us take out, and give me a few minutes before we leave to just kind of pick back up and just say goodbye together. So this is Madera Rogers Henry with Area Magazine, special report on COVID-19 with Dr. Kendra. And we had Tunde from Edmonton, Alberta, Canada, talking about what's happening there. So we thank everybody, and they're going to tone out. Stop it. Always learning.